So I think for me, I mean, when I started out as a hand therapist, been doing this, what, 30 years now, everything's focused on the hand. You're always, like you said, you're always zooming in. At least that's the way I was taught, right? Or that's the way I self-taught myself, whatever. And I think it's only within the last 10 years or so that I've been stepping into the comfort zone that I'm not particularly comfortable with and going proximally. And I still feel that my knowledge in that area is lacking, but I do go that direction. And it's amazing what you find when you do that, that you find that the distal portion is very reliant on what's going on proximally. So it was just interesting to make that parallel connection, watching it before my eyes with Kimberly doing it and having seen you do it. It was just the perfect kind of reassurance that that is the right way to go. And we've seen from Kimberly's other sessions when she's doing the whole body that sometimes it's somewhere else entirely. It's a knee or an ankle or whatever, that is a hang up or part of it. It's just that we have to treat the whole body.